Okay, I've got a couple of questions about suitability. If I can, I'll merge two of them and can address them. The first question came in last night. Is age a barrier to focal therapy treatment, assuming someone is otherwise fit and healthy? If it is, what is the cutoff age? And does the effect of anesthesia play any part in the decision on whether or not to operate on an older patient? That's the first question. And the second question is, how suitable are bilateral cancer sufferers and maybe anterior or posterior lesions and anterior and posterior lesions for focal therapy? They would require two procedures, I think. So it's a little bit around someone has two
Hmm.
lesions. So the first one
Yeah,
is about age, and
yeah,
the second one is more than one lesion.
sure. So the question about age, in my view, at least, is that chronological age should not matter. It's biological age that is the important factor. So you can have a very fit and active 80-year-old who cycles 10 miles every day and so on, and says, "Look, I've got 10 years left to live. Why am I not getting any treatment for my prostate cancer?" Equally, you could have a man who sadly is only 65, but has a lot of heart morbidity, has got a lot of other problems, comorbidities, and so on. And therefore, they may not be suitable for a treatment option. General anesthetic does play a big role in, and an ability to have a general anesthetic does play a big role in deciding whether somebody can have either a focal treatment or a radical treatment. So you need to be fit enough in order to have a general anesthetic. And obviously to have a focal treatment, you don't need to be quite as fit as somebody who's having a radical treatment option. So the short answer to the question is that age should not play a barrier. I've treated men in their early 50s who want to preserve function, and I've equally treated men in their early 80s and beyond who are very fit and healthy and active, and they've been offered radiotherapy alone, and they've said to me, "Look, if I can avoid hormone treatment and radiation for another 4 or 5 years, then I'd be delighted." And they lead a good quality of life having had the focal treatment. But it's important that each individual is assessed on their own merits. But age should not be a barrier to treatment in my view. The second question is a much more difficult one to answer, and that is if you've got more than one focus of disease. I put up a slide on what the standard criteria for selection of candidates for focal therapy is. And that is that it should be grade 7 or below, and it should ideally be on one side of the prostate. So if you've got a couple of areas which are close by on one side of the prostate, then there's absolutely no issue with ablating that whole area in a focal manner. If they're, say, at opposite ends of the prostate and there are other multifocal areas, then focal therapy is probably not the right treatment and you require a whole gland treatment option. My background is I started off doing whole gland HIFU. I was one of the first surgeons to go to France to learn the technique over 20 years ago. But we have changed the outlook on treating whole gland with these modalities because we know there are better whole gland treatments available, such as radical prostatectomy and radiation-based treatments. So we tend not to treat the whole gland, but selectively, if a patient wants it, we can treat more than one lesion. It can sometimes necessitate two separate treatments. And the argument behind that is that you're more likely to preserve function because you put less heat into the gland at the same time. So you may require more than one treatment on two separate occasions if you really wanted, treatment on both sides of the prostate. But generally speaking, we tend to treat one side of the prostate.